WGN investigates a pediatric doctor accused of botching a surgery. A new lawsuit says he operated on the wrong eye and used non-sterile instruments to try to correct his mistake. We should warn you, some of the images in this story are a bit graphic.
I was so nervous and scared and just not understanding what was going on.
Sutton Dryfout was 19 when she went to a pediatric ophthalmologist a year and a half ago to correct a lazy eye and remove a cyst in that same eye.
And when Dr. Tico came in, we said left eye cyst removal, left eye muscle fixing.
So they were checking repeatedly.
Everyone checked, yeah.
The consent for anesthesia form lists left eye, but when Dryfout emerged from the haze of anesthesia in a recovery room, she says she had pain and blood-soaked tears coming from her right eye.
There was a nurse at my bedside and I said, "Why is my right eye hurting? You weren't supposed to touch my right eye." And she's like, "Well, I don't know. Let me figure that out for you."
The lawsuit filed against Dr. Benjamin Tico says the ophthalmologist returned to the recovery room and told the nurse he forgot something and proceeded to operate on Sutton's left eye.
There were nurses rushing around. Someone was holding my head. They were holding my eye open. He had brought a needle up from I don't know where and started sticking a needle in my eye. And there was burning, and he brought scissors up and started cutting, and I was scared because I was telling him to stop. He wasn't stopping.
The lawsuit also states Dr. Tico was not in a sterile environment when he performed that second procedure in the recovery room, did not use gloves, and used instruments from a prior surgical patient's instrument tray. Did the doctor acknowledge a mistake?
He did not.
Sutton's mother says when she was finally permitted into the recovery room after the second procedure, the doctor insisted she initial a change to the surgical consent form. Left was crossed out, right eye was added.
We did ask him what happened in the recovery room, and as he backed out of the room, he said, "I didn't think she would remember."
I'm Ben Tico. I'm an ophthalmologist practicing on the southwest side of Chicago.
In an email, Dr. Tico told WGN Investigates, "I really would like to refute all the charges in this unfair lawsuit. However, due to issues of patient confidentiality, my attorney has instructed me not to comment publicly."
Simply put, he operated on the wrong body part.
Valerie Leopold represents Sutton Dryfout in the lawsuit.
Anytime a patient asks you to stop, if it's not an emergency life-saving situation, I think, in my opinion, just as not only a lawyer but a parent, there's an obligation to stop.
Sutton Dryfout is now employed as a surgical technologist and says she always remembers her own ordeal when helping patients through their own procedures.
My biggest hope is just that people will see this and it won't happen to anyone else.
Dryfout says she continues to suffer from double vision and other complications as a result of the procedures. Again, the doctor called the allegations unfair but said patient privacy prevents him from saying